Not really. We are using needles, so you're going to feel something. Most people just kind of refer to it as a little prick or a little pinch. And then once the needles are in, you don't usually feel anything. And I always tell people that they're in total control of their treatment. So if something feels uncomfortable or just doesn't feel right to you, then you can let us know and we can adjust to make sure that you're relaxed and get a good treatment. Yeah, so we can really treat just about any condition, but a lot of things that we end up treating are things like pain anywhere in the body, especially back pain, neck and shoulder tension and pain, knee pain, um, tennis elbow. We see a lot of colds and flus, digestive issues, headaches, migraines, a lot of stress and anxiety. And so we really treat the whole body and the person as a whole, so we can kind of treat anything. Yeah, so a lot of people for pediatric acupuncture bring their kids in for ear infections, again, digestive issues. That's a big thing with kids, constipation, loose stools. Another big thing is sleep issues, teething, eczema, coughs. Those are the big things that people bring kids in for. Acupuncturists in the state of Colorado are required to go to an accredited school, and it usually takes between 3 and 4 years to complete all the schooling. It's over 2,000 hours of schoolwork, and a lot of that is actually clinical practice, which is very helpful. And then after you are done with your schooling, you sit for 4 board exams, and once you've passed those 4 board exams, then you can start the process of becoming accredited with the state. And after you have your license, then every 4 years you're required to complete some continuing education credits and keep up on your licensing and your practice. Yeah, I practice mainly 2 forms of acupuncture. One is called traditional Chinese medicine, or TCM, and the other is a Japanese style of acupuncture. And the Chinese style is based on meridian theory, and the Japanese style is pretty gentle. You're not really inserting the needles very far, but it's still very effective. And then adjunct therapies that I typically use are things like shiatsu and tui na, which are both medical based massages, and cupping. Occasionally we'll use moxa, which is an herb that we can burn. It doesn't come in contact with the skin, and it's very safe. And we'll also use non-needle techniques. We have tools for that, especially for pediatric treatments. We typically don't use needles. And then we'll use diet and lifestyle therapies too.